Storylines webinar this evening. My name is Tanya Winders, and I am the President and CEO of Allergy and Asthma Network. We are the nation's largest nonprofit dedicated to ending needless death and suffering due to asthma, allergies, and related conditions. And it's our pleasure this evening to present this webinar and to introduce this Asthma Storylines application, a self-care tool for managing asthma, to each of you. We launched this mobile application at the beginning of August in coordination with the Asthma Educators Association meeting, as well as the Physician Assistants and Allergy, Asthma, and Immunology meeting, and have also launched it to the public through our social media sites and electronic newsletter. And we are so excited about the initial response over these first several weeks. We felt that it was important to host this webinar this evening to highlight all the functions and tools of the Asthma Storylines app and provide you all an opportunity to ask any questions you may have in regard to use of the app. We've chose our partner carefully, and we have partnered with Health Storylines, who has developed a number of self-care tools such as Asthma Storylines for a variety of different disease states. And tonight we're going to take a look, or this evening we're going to take a look at how we can track symptoms, record topics to discuss with our physician, our healthcare professional, to also provide reminders for appointments and medication trackers, as well as to journey about our condition over the course of time, whether that be activities of daily living or about symptoms on a day-to-day basis. And so again, it is with great pleasure that I introduce Yuen Sim, who is with Health Storylines and helped on the project for Asthma Storylines. I'll turn it over to Yuen, and she will begin the webinar at this point. Please, throughout the presentation, feel free to ask any questions in the control panel. All lines will be on mute, but you can note a question in the question control panel, and we will address those appropriately throughout the webinar. There will also be a question and answer time at the conclusion of the webinar. So with that, welcome, Yuen Sim.
Thanks, Tanya. Hi, everyone. My name is Ewan, and I work with Self-Care Catalyst. We're the company that developed the Health Storylines platform, which is currently powering the Allergy and Asthma Network app called Asthma Health Storylines. So on my screen here, you see the Asthma Health Storylines app. It's actually a web app. So what that means is that it's available on both your desktop computer through your browser, also as an app for your Android or your iOS device. And this app is completely free, so you can feel free to download it. Some of you on the call today might already have downloaded the app, and some of you might not. So it'll be great if you can download the app and we can walk through it together, as it'll be really helpful to walk through all the features and benefits of the app together. So the app is called Asthma Health Storylines. You can find it in the Google Play Store on your Android device or in the Apple App Store if you're using iOS, both for iPhones and for iPads. If you're using a computer, feel free to go to asthma.healthstorylines.com and you can use the web version. So this is Asthma Health Storylines, and as I mentioned to you, we developed this in collaboration with the Allergy and Asthma Network. And one of the biggest insights that drove us to develop this tool was that we recognized that managing any chronic condition is always multidimensional. You use many different aspects to manage your health. It could be using a medication tracker or tracking your symptoms. And this tool that we developed was really customized for people who might be suffering from asthma, whether for themselves or if they're taking care of a family member, a child who has asthma. And some of you on the call today might be healthcare professionals or even asthma educators. I'll talk about how the features and benefits of the app can benefit you in working together with your patients or your clients to help them have a more effective conversation with you, and also be able to share what they've tracked over the last couple of months or in between visits to have a more meaningful conversation. So what you see on the screen here is the Asthma Health Storylines app. When you first download the app, you'll be taken to a login screen. Just feel free to set up an account. It's completely free, as I mentioned, and all you have to do is to put in your email address, put in a password, and you can log in. So upon first login, this is the screen that you'll see. So all the tiles that you see on the screen here are what we call health tools. So we have a variety of different health tools on the Asthma Health Storylines app. Some of them might be useful if you're managing different conditions, but the last three tools that you see here are the ones that we customized together with the Allergy and Asthma Network, because we found that they're really useful for people who are using the app for asthma. So I'll take you guys through each and every one of the features of the app and talk about the benefits and how you can use them. And we'll be taking questions throughout at the end of the session. So the first tool that you see here is the medication tracker. In the medication tracker, what you can do is you can add medications that you're taking. So of course, if you're using the Asthma Health Storylines app on a mobile device, whether it's your Android or your iOS device, you'll be able to get notifications on it. So by using the medication tracker, what you can do is to put in the medications that you're taking. It could be your asthma medications or even medications that's not related to your asthma. Feel free to put it into the medication tracker and set a reminder for it. And on your mobile device, you'll actually get an alert when it's time to take a medication so you don't forget. It's really easy to add medications. All you have to do is to click on this button here and type in the name of the medication you're taking. So for example, if you're taking Advair, you can put that in and it gives you a list of different types of medication based on the name, and you can just add it. So once I do that, I can add a reminder. So I can put in 9 a.m. and then click on finish. So now you not only have a schedule of the medications that you have to take, but now you have an accurate list of all the medications that you're on. So the next time you see a pharmacist or even your doctor or your nurse or an asthma educator, you can have this list with you so you can discuss any potential side effects or drug interactions. Each time you get a notification to take your medication, you can come into the app and note whether you've taken or you've skipped it. And when you do that, you actually get to see a history of your medication activity. And this is really useful because now you can look back and look at how your medication history is impacting other aspects of your health. And how you do that is by going to a feature called My Storylines. In My Storylines, it takes together all the data from different aspects of the app that you're using to track your health and put it all in one place. And this is really useful because, as we know with asthma, the symptoms might come and go, and it's really important for you to stay on top of those symptoms in between visits to your doctor or your nurse or other members of your care team. So you can use it to identify any potential triggers or any symptoms and signs that might be changing. So if you scroll down the page here, you'll see many different aspects of tracking your health. You have the medication tracker, the symptom tracker, and it's really useful to have it all together on one place. And the benefit of having Asthma Health Storylines also available on the web, on a desktop computer, is that you can easily print this out and bring it to your doctor the next time you see him. So you can use it to have a conversation with him about how a treatment might be working for you or not, or how your symptoms are changing over time. So going back to the health tools, the next feature that we have here is a symptom tracker. With a symptom tracker, what we allow users to do is that you can add symptoms that you want to track. So we know that symptoms might differ from one person to another, and you might be managing other conditions as well. So you can put in any symptoms that you want to track, whether it's related to your asthma or not. Just click on Add a Symptom, and you can come in here. So let's say you're also dealing with joint pain. You can just put it in here and click on Finish. So we have a list of symptoms here that are related to asthma, for example, nighttime wheezing, chest tightness, shortness of breath, but also symptoms that might not be related. So feel free to just rate your symptoms on a daily basis. And when you click on Done, it actually gives you a very visual representation of how your symptoms are changing over time in terms of its severity. And you also get to rate your symptoms' impact on your day. So that's your own quality of life assessment on how your symptoms might be impacting you. The next tool that we have is the Daily Moods feature. So with Daily Moods, what we have here is a collection of moods, both positive, negative, and also neutral. And what we learned from a lot of patients that we spoke with was that emotional health is often ignored when they're in a medical setting. So they like tracking it at home because they can now see the impact of a treatment program or the symptoms or other aspects of their health impacting their moods. So what you can do here is you click on a certain mood. You can put in some reasons why you feel that way as well, and click on Done. And when that's done, you actually see a visual representation of your moods over time. You can see your moods changing throughout the day and also throughout the week and go back in time. The next tool that we have is the Daily Vitals tool. What you can do on this tool is that you can add vitals that you might want to track. could it be related to asthma or not. So what I have here is weight, and you can change the unit that you want to track in. And as you do that, you get to see your weight's history and how it changes over time. The next tool that we have here is an appointment calendar. So in the appointment calendar, it's really great to have this calendar in the app, because if you're using Asthma Health Storylines to manage all your health in one place, it makes sense for you to put in your appointments with your healthcare provider in here as well. So just put in, for example, appointment with asthma educator, and you can put in the time of your appointment and also the date, and even notes on what you need to bring or prepare for that visit. And when you add that to your calendar, on the calendar you'll get to see all the different appointments that you have. The next tool that we have here is My Journal. So one thing that we learned from speaking to a lot of patients with chronic illness is that journaling about their health can be very therapeutic. So that led us to develop this tool that we've identified some topics to guide journaling. So the topics that we have chosen here are very positive. So for example, reflection on your condition, there's a question about gratitude, and also accomplishments. We learned that it's really important for people dealing with chronic illness to actually write about their accomplishments, because they might feel like they're not really accomplishing that much if they are experiencing any symptoms or if they're just diagnosed. So being able to write that all down is really good for them to keep a positive outlook. So going back to the health tools, the next tool that we have here is Healthy Doses. So we really wanted Asthma Health Storylines to be a very holistic tool for people to manage asthma, but at the same time not being always about the condition or about tracking symptoms or just taking medications. We also wanted people to get a little dose of positivity when they use the app. So that's why we created this tool called Healthy Doses. And as the description says here, collect a healthy dose of wisdom for your mind and spirit. So what users can do if they're using Asthma Health Storylines is to come into this tool and select daily whether they want a little dose of gratitude, mindfulness, or optimism. And what they get is actually a positive quote that they can choose to save and have it on their app, so they can always come back and look at it. So I've talked about all the what I'll call the core tools that are part of the app that could be useful for anyone who's if you're managing a different condition or it's asthma, and you can customize those tools to use it for your general health. And now I'll talk about the custom tools that we developed together with the Allergy and Asthma Network that we have identified through interviews with asthma sufferers, with parents, and also through talking with the Allergy and Asthma Network. So one tool that we created here is Daily Asthma Control. And this is a really useful tool because we really want to motivate people to be on top of their symptoms and to track how they're actually managing asthma over time, so that by recognizing how their symptoms change or by recognizing any triggers, they can actually hopefully get better control. And by tracking the daily asthma control, it gives you a good tool to speak to your healthcare provider. So we know that you could be using this tool for yourself if you're an asthma sufferer, or if you're a parent looking after a child who has asthma, you can use this for them as well. So we have 3 categories of rating. We have impact of asthma on physical activity at home, also the impact of asthma on your physical activity at school or work, and also on your sleep quality. So on a scale of 0 to 10, you can rate that on a daily basis, and also take down notes as to whether you have used your rescue inhaler and also some of the triggers. And when you click on Done, it actually builds, again, a graph here that you can see how your daily asthma control is changing throughout the days. And if you click on more detail in the feed, you actually get to see not only your rating, but also your details on your rescue inhaler usage and also triggers for your asthma symptoms. If you're a healthcare provider or if you are an asthma educator working with a client, this is a really useful tool for you to collaborate with them on treatment strategies or even asthma management strategies, because you can identify what are some of the common triggers that are, causing their symptoms. The next tool that we have here is questions to ask. So this is a really useful tool for you to prepare for the next time you go into a clinical visit with your healthcare provider. We know that you might have many questions that you want to ask your healthcare provider that you might forget. And also one thing I forgot to mention at the beginning of the call is that the Asthma Health Storylines tool is available on all platforms, which means that you can use it on your computer at home and also on your smartphone, but all your information is actually saved with your account. So you could be using this tool at home, you could be typing in your questions on here, but your information is actually saved on your account. So if you're using it next on your phone or on your iPad when you're sitting at a clinic, you can actually pull out all the information. It's going to be saved on the cloud associated with your account. So you can be writing in questions the night before, the week before, and have that in your hand the next time you're visiting your doctor so you don't forget the questions you want to ask them. And also on the Allergy and Asthma Network website, there's a wonderful resource on potential questions that you could ask your doctor. So using that as a reference, you can always put in really useful questions and be prepared the next time you go for a visit. And last but not least, we have a health reports tool. So with the health reports tool, you can use it if you're using a phone, easily upload a copy of a health report. So you could just take a photo of it, and when that's done, in the history you actually get to see a picture of it. So I explained all the different tools that you can be using on the app, and again, going back to Storylines, you see how all of that comes together onto one page. So you could be looking at your symptoms and how it impacts your mood, or how your medication behavior is actually impacting your vitals and all of that. So this becomes a really useful tool to have all your health information in one place. So you not only learn more about your health, but you also have all the information you need when you visit your care team and be able to have that more productive conversation so that they actually get to see the full story. So the next feature that I want to bring up is actually a new feature that we have called Sync a Device. So we know that a lot of people now are really tech savvy. They might be using connected wearable devices. For example, I'm sure a lot of you on the call today might be using a Fitbit or a Jawbone to track your activity. So maybe you're running or your sleep activity. And we also have other connected devices here. For example, if you're using a blood glucose monitor or a heart rate monitor, whatever is you can see if your device is on here. So what it actually does is that you can connect with those devices so that it imports your data from those accounts and put it onto your Storylines here as well. So for example, if I use a Fitbit, I can just click on turn it on. I'm not actually going to go through the process here, but you can see how easily it is to just turn it on, give permission to Asthma Health Storylines to actually import that data. And when that's done on the Storylines page, at the bottom of the page, there's actually this section here called Data from Synced Devices. The activity from my Fitbit would be a graph on here as well. So now on my Storylines page, I actually get a very robust representation of all aspects of my health. So at the side here, we have identified, together with working with the Allergy and Asthma Network, some really important resources that people might want to use. So we have what we have here is the asthma control test. So whether you're an adult who's suffering from asthma, or if you are managing asthma for your child or your loved ones, here is the asthma control test questionnaire that you can easily click on from your phone. So the resource is really accessible from the app, and you can do this every time before you go for a visit with your doctor. So the asthma control test gives you an ACT score that becomes a really important piece of information for you to communicate to your healthcare provider. You can easily print this out and use it. And what we have on the site as well is information and resources from the Allergy and Asthma Network. So we have information about the organization, and also, most importantly, links to various patient resources that could be really useful. Another feature that we have on Asthma Health Storylines is what we call the tool library. So we know that some of you might be suffering from some other conditions other than asthma, and you might be looking for tools that can help you better manage those different conditions. So what the tool library does is that it takes together all the different health tools that that is powered by Health Storylines. So the Asthma Health Storylines app also has access to all these different tools. So for example, if you are a patient who also has like IBD, you can come onto here and select the stool diary and might choose to add that to your home screen. So when you do that, you actually get the stool diary on your home screen and you have an extra tool that you can use. Another way to do that is to go to your profile and put in any other conditions that you might have. So I'm just going to start from scratch. So when I go to my profile, for example, let's say I have epilepsy. I can add epilepsy to my profile and click on update. So when I do that and go back to my health tools page, so I've added diabetes and epilepsy. So you'll see that on my home screen now, when we just did the demo, we only had until health reports. So now with the other conditions added to my profile, I've actually personalized the app for myself. So for my diabetes, I have my physical activity log and also meal portion control and information on diabetes foot care. And also for epilepsy, now I have a seizure diary. So this is how you can customize the tool for yourself to not only manage your asthma, but any other conditions you have. We also have a feature called Circle of Support. And what the Circle of Support feature does is that you can add, if you're using this as an asthma educator and you are working, or if you're working with one, you can always add their email on here, or if you are suffering from asthma and you want to keep your family updated of what's going on, you can easily just put in their email address here and choose to share your story with them. So by default, nothing gets shared when you add somebody into your Circle of Support. But after you do that, you can go to each individual health tool. For example, if I want to share my symptom, I can click on who can view this story and select whether I want to share it with my family or with my friends. And of course, you can also exchange messages with people in your Circle of Support on the app. So that concludes the demonstration of what Asthma Health Storylines does, and I will now take questions from the audience.
Thank you, Lynn. A wonderful overview of the app. So I will now open it up for questions. If you would like to ask a question in the control panel of the GoToWebinar in the upper right-hand corner of your screen, you can click on the Questions tab and submit your questions there. First question, is it possible to customize the tool to enhance management of food allergies?
Sorry, could you say that again?
Is it possible to customize the tool to enhance also the management of food allergies?
So right now we don't have a food allergy. Actually, we have a food diary in our tool library, which I might be able to pull up. So for example, if you, not necessarily about food allergies, but we have a tool that helps you to track food reactions that might not be caused by allergy, but could be based on other conditions. So for example, if I put in ulcerative colitis, and I go back to my profile, let me see if it's in the tool library. So under nutrition, we have some tools here. For example, we have a meal tracker, a food diary, a diabetes diet log, and also another diet log. So if I add the food diary to my home screen, you see it appearing here. And with the food diary, what you can do with it, let me just refresh. It's not really showing up here, but we do have tools in our library that helps to manage food reactions. Unfortunately, it's not showing up right now, but we'll be updating our tool library with we don't really have a tool that's specific to food allergies, but we have one for food reactions.
And just from the network's perspective, that is something that we have looked at in developing in addition to the asthma storylines, is to moving to the next generation and having a food allergy storylines app as well. So yes, we do plan to do that as well. The next question, can the tool be enhanced to do more of identifying asthma triggers and addressing environmental control of asthma?
So we try to address that by using the daily asthma control, where the user is self-identifying the triggers for their asthma. So by doing this on a daily basis, when they go into the history, they actually get to see an actual documentation or a log of how their daily asthma control is changing in relation to the different triggers that they're experiencing.
And additionally, in some of the resources and tools that are available on the links from resources, you will see the Indoor Air Repair Kit, which addresses specific tips on how to remediate and control those triggers in the environment. So yes, we do see this as a very important aspect, and we're actually looking into, again, other sensors and tools that we could connect through the tool library. That was the thinking of a device that can actually monitor indoor air quality as well as pollen counts. So that will be an expanded offering through the sync device function that Ewan outlined earlier. Okay. Next question, can the physician see all of the data on their computer?
So right now the tool is not syncing with any sort of physician platform. So we really encourage the users to be using the Storylines feature to be armed with all the information when they actually go to see a doctor. So the doctor's not going to see it on their computer, but you can choose to print this information out the next time you see a doctor and have that information with you.
But if the doctor chose to provide his or her email, they could be added to that care team. Yes. And the information could be shared in that manner, correct? In the circle of support.
Yep.
So yes, the physician could see all of the data on their computer if they give the patient access to their email.
Yes, so I'll explain how the circle of support works again. So for example, if I put in, if the name of my physician is, let's just pretend that this is my physician, that's my account, and I click on submit. So now my physician will accept my invitation to be part of my circle of support, and I can just create a group called my healthcare or my care team, add that group, and put my physician in that group. So now I have a group called my care team. So when I go back to my health tools, I might not want to share everything with my physician. So I might not want to share my moods and my journal with my physician, but maybe only my daily asthma control. So I can come in here and click on who can view this story and click my care team. And when I save, so my physician now on his side, he would be able to see only this portion. So he won't be able to see my entire storylines, but what he will be able to see is only this graph here, my daily asthma control. So by default, nothing gets shared because we recognize the how health information could be very private to some users. So nothing gets shared unless the user has decided to add somebody into the circle of support and clearly stated in one of the health tools that that information will be shared.
Okay. Any additional questions from the group? I will reinforce that the Allergy and Asthma Network chose to develop this as a first generation of a mobile health application to help in the self-care and self-management and coordination of care within the healthcare team. So we see this as an important first step in using mobile health to help patients identify what those trends in their symptoms as well as their medication monitoring and things like that. And again, a wonderful way to communicate that to everyone from the school nurse to the asthma educator, also to the healthcare professional, their physician, primary care, and subspecialist. So the next question is, can the physician adopt this into the EMR? Is there ability to incorporate the data into their EMR?
So right now we're not connected to any EMRs at the moment, and that would be something that's longer down in our roadmap.
Yes, and I can just say, as we have explored this with a number of EMRs, we are looking at ways that we can integrate and provide that data into those most commonly used. We have had early discussions with Epic, which is the largest EMR provider here in the country, and they certainly are interested in ways that we can incorporate this type of mobile health information to optimize health outcomes. But I think that we're still a little ways from that day, unfortunately. Any further questions? Another question, can this tool be used to have an in-home asthma assessment and completed by an asthma educator or community health worker?
So definitely this tool is useful if you're working together with an asthma educator. You can always bring this to get when you're speaking with them and get them to either help you complete the daily asthma control tool or use the ACT test here that's on the site. Actually, during one of the earlier webinars today, one of the participants mentioned it will be really useful to have an ACT score tool for them to record the trends on how their scores changed over time, and that's something that we'll definitely look into.
Additionally, I would say from the network's perspective, if you have a standardized in-home asthma assessment that you would like to be used by an asthma educator or community health worker, we could explore how to incorporate that into the app and have an additional tab developed for that. So we are looking, again, this is a first generation, and we're certainly looking for ways to enhance that, and I would encourage you to reach out to myself, Tanya Winders, at allergyasthmanetwork.org to provide those suggestions. Any added questions? Just one additional note, we will be providing a playback of this evening's webinar, as well as a two-page quick reference guide to using the app. And I would also like to reinforce that the app is free for all users and available for download, that also available on the web, as was explained at the outset of the webinar. If there are no other questions, we'll give it just one more moment, and then we'll go ahead and close out our time together this evening. Again, I'd like to express my sincere gratitude to Health Storylines and to Self-Care Catalyst, who partnered with us in developing the app, and to the Allergy and Asthma Network team who worked tirelessly to bring this to fruition. And again, to all of you who have already begun to use the app, we've had several hundred download the app and begin to use it just in these first several weeks, and we're looking forward to seeing those numbers continue to increase. The network will also provide cards that you can share with your patients, as well as information about joining the network, being a part of the network. Again, this is completely free information, free support through Allergy and Asthma Network, and we would be happy to send those cards out that you can share with your patients. One final question. If you as an asthma educator are included as a member of the Circle of Support, how do you receive those notifications from the participants? Is it email, or do you have to have the app?
So right now, the way the Circle of Support works is that you would have to have the app as well. So if you don't have the app and you get a Circle of Support invitation, you actually get an email. So if you don't have the app, you'll get an email sent to your account where the patient was trying to add you at, and you'll get an invitation to actually download the app. So once you download the app, the patient will be in your Circle of Support, and you'll have to accept that invite. So that's not going to be a separate interface for like an asthma educator. It's still the same app, but what you can do is in the Circle of Support, you'll actually get to see your patients here.
Wonderful question.
Yeah.
Okay, well, I think that concludes our time together this evening. And again, thank you all for your attendance and for your interest. We hope that you find this to be a valuable tool. And again, we'll be following up with an email within the next 24 hours for the playback and recording of the webinar recorded earlier today, as well as this evening, and that quick reference guide that we spoke of earlier. Thank you again for your time.
Thanks, everyone.